Welcome to Crypto Disrupted, a cryptocurrency and blockchain podcast with your hosts, Trent Lipinski and Greg Kerr.
Well, welcome again to another Crypto Disrupted. Today we're going to talk about as we're looking for problem solvers and solutions and self-betterment and how the blockchain is going to influence our lives and better humanity. We have a good guest today with Noel Chandler. He's calling in from Costa Rica, and he's here to talk about Clinicoin, which is a health and wellness-based currency. And welcome to the show.
Thanks so much for having me.
Yeah. So tell us quickly who you are and what projects you're working on.
Yeah, so my name is Noel Chandler. I go by Noel down here in Costa Rica as well. I'm one of the co-founders and the CEO of a company called Mocio. We create mobile messaging solutions for the healthcare and clinical research industry. And we're launching a project, a blockchain project called Clinicoin, coming up here really soon that we've been working on for a while. To improve global health and wellness, but also backed by elements of the healthcare and the research industry to make it sustain. So our background, the company's 10 years old. We've been working in healthcare and research for about the past 7 and been focused on that just for the past 4. So we work with a lot of healthcare organizations, NIH-funded studies, in clinical research, whether it's behavioral sciences, new therapies, pharmaceuticals, but mostly in the behavioral sciences component of things. And one of the things that we've noticed in speaking with those particular clients is that a lot, and especially in research, but also in general healthcare, there's a lot of problems and a lot of challenges caused by what's called low engagement, low patient engagement. So research studies are having a hard time filling, the spots that they have for them. They have a hard time keeping people in them. And then there's a lot of problems in healthcare with medication adherence. So 10% of all emergency room visits are caused by people not taking their medicine as directed. And then those problems also happen in research as well. If in research, when you're participating, you're a piece of data. So if you don't stay in or you don't do what you're supposed to, then you become bad data, and that's very costly and frustrating for people that are running those studies. So that's the business component of it. But when we started looking at what our clients are interested in, we started finding out that obviously they have that interest in incentivizing people, participants, patients, whatever you want to call them, to take part in these behaviorals that they need, these desired actions, so to speak. And we looked at that we almost reverse engineered this component of health and wellness, a health coin or health and wellness community, because we figured that we already have the customers and the clients that will have those individuals using the application in a secure messaging component. But if we can look at what will motivate people to utilize this and what will make health and wellness fun, then we've got the perfect mix where we have this. I call it the digital intersection of wellness, healthcare, and research, all in the same place, with people being able to participate and being rewarded and incentivized for focusing on their health and wellness.
All right. So I saw this concept once explained to me in the utility of all these targeted drug ads on TV, where you go back and forth, is it the right thing to do, blah, blah, blah. And then it comes into this idea that those ads got people to go see their doctor, no matter under what context.
Right.
And it actually, the overall impact was positive. And so as you explain it, I'm thinking, okay, maybe that's the largest bridge and problem solved, is you're creating something that engages you in your own health, which is kind of step one to make sure that you're somehow creating a diagnostic lifestyle, and that ultimately results also in working with medical professionals or some kind of medical platform, right?
Yeah. I mean, the reality is that we're all patients at some point in our lives, and statistics show that we're not not really very good at it, to be honest. It's not that we don't care, but, on a personal note, my mom she forgot to take her blood pressure medication about a year and a half ago, and she had a mini stroke. She takes it every day, but, life got in the way. And so she uses our technology. And one of the things that we started doing is our technology was, in certain aspects of research, it kind of has to be, I don't want to say cold, but kind of cold, because it needs to be, all the content needs to be approved. And so when we were looking at and it's, we're B2B, so we're selling this to healthcare organizations, and ultimately they're going to give it to their participants or their patients for those reminders, or, appointment reminders, take your medicine, fill out your journal. And so I said, well, what would make it fun for her? So I just started calling it Medibot, and injected her name in it. It's like, Carol, it's time to take your medicine, don't make me remind you later. And just to get an idea of what it was like. And so I would call her and I'd say, is it annoying yet? She's like, no, I beat it. I try to beat it. I try to take my medicine before Medibot sends me a message. And so it was really we've always thought that elements of health and wellness can be fun. And that was really a big eye opener for me to think that, hey, you can actually speak to people on human levels. It doesn't need to be this robotic function, even though it's automated and, a human isn't sending it out. But that can be applied to so many things, whether it's making sure that you show up to your appointment on time, following doctor's orders. And I don't mean just even doctors, but whether that's a physical therapist, even a chiropractor, and telling you they need to take part in, specific things and specific exercises. And there's just a whole world of opportunities of the ways that a platform like this is in use and can be utilized even more when you add digital currencies and rewards and incentives to an ecosystem.
So you're essentially gamifying wellness. That sounds like that's kind of the end goal here. And then not only that, it sounds like you're, based on the white paper, it looks like you're also kind of building an application platform. Can you kind of like talk a little bit about the tech and go into how you guys are using the blockchain and, what your cryptocurrency looks like?
Sure. Yeah. So you're absolutely right. The gamification of it. And, we've been talking about gamification and specifically in clinical research for a couple of years, and people always perked up. But we never really got asked for it in a proposal sense until about March or April. And where there's smoke, there's fire. So if someone starts asking for it because they're afraid that people are not going to be engaged, then we said, okay, now it looks like this industry is ready. So if you look at, especially if you look at our website and you look at components of how this is set up, it looks very much, and this is what we're building, it looks like a health and wellness, community and a coin, a health coin. We don't consider ourselves a medical coin or a healthcare coin. And in fact, if you look at other projects that are in the healthcare space, they fall in one of three areas. It's either, electronic health records or medical records. It's AI, and then it has to do with payments. So insurers. And well before we started seeing these and we were coming up with this idea, we were like, we have to focus on people. And then these blockchain projects started coming up, and I'm glad that they're doing it. But even when you see, these blog posts on healthcare trends in the blockchain space, like literally in the past 6 months, none of them have mentioned patients, which is just mind-boggling to me, because a lot of people in healthcare talk about, and especially in clinical research, is patient centricity. We got to focus on their experience, because if they don't show up, if they don't do what we're telling them, then yeah, it's bad for them. I mean, if my mom forgets to take her medicine, or your grandmother or anyone else, it's bad for family members. But in a study, it's bad for a lot of people. There's a lot of money associated with it, but it's also, medication non-adherence medication non-adherence and missed appointments are $478 billion healthcare cost every year from two things that people don't do, that just seem like things that you should do. So, and people have been asking us, okay, so I get it. I exercise, I earn currency. Well, what else? Okay, there's other models out there on blockchain and off blockchain that do that, but in our opinion, there are sort of they're sort of one-dimensional. I don't mean to be harsh, but they depend on, they're sort of broken down into three different things. They're either selling health data, which there's a number of them that are doing that. They're hoping that advertisers or companies will give them product in exchange for advertisements. So, you're trying to walk enough miles to earn enough points to get your Fitbit, and they're saying, hey, Fitbit, give us some free ones and we're going to advertise. And the Fitbit's like, I used to be in advertising and marketing. They're like, so we're going to give you free products to advertise to people that are motivated by getting our products for free. Like, when's the purchase going to happen? That kind of thing. And then the other one is which I guess it's working in some context, but it's zero-sum wagers. So I go on a site and I bet $50 that I'm going to lose 10 pounds, and you bet $50 that you're going to lose 10 pounds, and I lose 10 pounds and get $50, and you don't lose 10 pounds and you lost $50. That's really tough, that's really hard for someone to get excited about. And I'm like, this should be fun. So there's no shortcomings in all of those things. But when we were looking at how this works, we already had the bias of, well, we know what the industry wants. We know what the industry is looking for. And we also know that if we can excite individuals to take part in their own health and wellness, then we've really got something here, because the industry was sitting there waiting. And so that's sort of the combination of it. The bigger vision of what it is that we're doing with this platform actually also comes out of what we know about the industry. And it's that, we have clients that are coming to us right now and saying, we have a limited amount of funding for this really cool idea. It's a cancer center that we're working with. And we want to build a smartphone app. We can't get funding for the app. And in fact, if the pilot's successful, we don't think that we can even get funding for the app beyond the pilot. So they're running on our platform. And what we're saying is, let's build a platform. Let's have a platform, Clinicoin. Build your modules on top of that for the pilot, inexpensively. You don't have to build a mobile app to do it, because it's all sitting there. And then when it's successful and you get your funding, just keep adding modules. You don't need to start all over. And so the biggest vision that we have here is that we're building this open source healthcare platform that makes innovation easy for anyone that wants to create applications on top of it, while providing them with the largest number of individuals to be able to test and test a minimum viable product. And also just, it's very, very easy for people to understand how to use, rather than, it's hard enough to build an app, but then to get someone in a study, you have to train them. So that's kind of the biggest. I feel like I'm babbling here about it, but I'm obviously excited. But it's one of those things where you're like, people are like, you're a health coin, and you're like, it's not just that, it's so much bigger. But we're excited about, and it seems that other people are very excited about joining on this community and being positive, and this element of togetherness with, like, it's just more fun to work out and get healthy with other people.
No, and it sounds like you're taking a really reasonable approach, because, I've been working in startups now for, almost 10, 15 years. And ultimately, you have to take that kind of realistic approach. Like, what is that minimum viable product? What do you have to get to the market first? What do you have to kind of lay that foundation of what you're trying to accomplish? So, you've got your intention here, and then it's like, what are all those little baby steps that you have to figure out to get there? And it sounds like, you're doing your ICO fairly soon. So it sounds like, you've got this ICO coming out. You figured out, okay, we can do the ICO. We can start to get together some of the initial technology, start getting on the blockchain and figuring that all out, and then building this application platform and try to eventually accomplish your overall vision.
Yeah, absolutely. I mean, one of the things that makes us, I would say, different now, and in 12 months we won't be different, is that we're a 10-year-old company that has this novel use case. And some people, I think some people like it, and some people are like, well, you've been in business for 10 years. Why were you? Well, sorry, you've been in business for 10 years. Why are you trying to innovate? I'm like, what's that? I don't understand that question. It's like we fancied ourselves doing cool things in mobile messaging, when Apple was running millions of dollars in ads telling everyone they needed an app for that. And we stuck to text messaging because we're like, that's where the most number of people are. And in fact, some of our clients who know that we've been diehard about text messaging, when they heard about this project, noted the fact that you guys have been flying the text messaging flag and that no app flag for so long, and you're building an app. And we said, well, if the app that we're building, we're making it available to other companies like ours who want an easy way, an easy channel that's secure to be able to do this, but don't necessarily want to build an application and have those aspects of it. So we are building it. We are building an app and a platform around it, even though we were, sort of not diehard against it, but we just held strong to SMS. But we built something that we would like to use, frankly, that we would use.
Is the blockchain what changed for you, or what was that kind of moment where you said, okay, we've got to kind of shift our strategy here. We've got to pivot. What was that for you?
So, I mean, if we didn't launch Clinicoin and have this as a part of our company, which, by the way, the idea has gotten so big now that this is our future. This is what we're focused on. And this has been one of the most difficult parts about building this, is that half of the company already works at Mocio and serves clients, and everyone's excited about it. So they've been working nights and weekends, to get everything live. And then the other half are blockchain, individuals. The things that change for us is we've been delivering rewards and incentives for a number of years for clients. So that part of it hasn't changed. What changed for us was, okay, let's make this open source and make it easy for everybody. And then how do we make this even more useful? And that came down to decentralization and looking at elements of the ecosystem. And so when you look at open source and decentralization, for us, that was where things really, really changed, and looking at how the blockchain could be really, really useful, and how, we say even in our white paper and on our website, we believe that collaboration and not competition is going to be the thing that changes and truly makes innovation happen in the health and wellness space. And the other thing that really changed for us was being able to look at all companies, all developers, all software companies, all providers and organizations as potential partners, and get them excited about this. And some of the feedback that we've been getting, obviously from our existing clients and partners, but even people that, we've only been out of stealth since Monday. And people are messaging us and saying, like, I had a guy message us yesterday and said, he runs a meditation program for vets. And it's a really, really cool program. It helps them deal with stress. And when I got and I meditate every day. So someone forwarded on to me and said, hey, what should I tell this person? I said, tell him I will definitely get back to him. It might take a couple days, but I got chills, because that scenario is what this is going to be over and over and over again once people get it, once they start understanding what can be done. And
run us through that scenario. If you had a group of vets that were, like meditating through this program, and they're earning coins or some kind of credit system where they're proving that they did that, right? Uh-huh. And does that get reported back to the VA or back to insurance policy, kind of showing that these programs are actually functioning?
Yeah.
So what's the utility of it?
Yeah. So we have a function called proof of engagement. And that's really our tokens we're minting 3 billion tokens, so we won't do any more, but the proof of engagement is sort of our mining, if you will, of those particular tokens. And there's two ways that happens. One is, if you're a health app developer, and you have a health app, a tracking app or whatever, you can connect to the platform as a node, link up to the platform. And then when your users link their account with Clinicoin, then they can continue using your application and earn tokens from the rewards pool that we have from using that app. So that's that component of decentralization. We're not trying to get everybody just to come to our thing.
Okay.
And maybe I should take a step back and explain that of the 3 billion tokens that we're minting, 600 million of those are going to this community rewards pool. So the way that it seems to make the most sense to people is think of Steam It, but for healthy activities. So you go jogging, you meditate, you swim. I mean, and basically, any kind of activity. And those individuals, those developers with those health apps, we call them validators. The other kind of validator would be an activities leader. So it would be someone that owns a running club or an exercise instructor. They can actually create an event on their phone. It would pop up a QR code, and then everybody could scan that QR code to confirm, hey, we participated in this activity together, and then they would get credit for that activity. So, we wanted to be friendly to the people that were technologically savvy, but then people that, that still wanted to make a difference and were bringing, pools of people together. An app developer that has a great tracking app is doing a good service for their users. I use Insight Timer as my meditation app, and they had a group on there who, we're going to meditate every day for 365 days. That app got me to do it. I'm on like day 400 now. That app got me to do it and being able to check in. And so they're doing a good service there. But in the vet sense, bringing individuals together to meditate in that context, I think, is just even more powerful because you're not on a cushion by yourself. You're actually connecting with other people in that way before and after, and even during. So in that particular context, they could reward people. They could either just have everyone together. We have our group messaging function we're calling Teams. So they could use it for meeting. They could use it for meeting up and communicating. They could use it for assistance. But the leader of that team could, depending on whatever function they wanted to have, they could distribute tokens to those individuals for things. I don't know. I don't want to be presumptuous about how this particular individual would necessarily go about doing this, because I don't know how things work in terms of their financing. But I also got contacted by a business owner who said, I want my employees to exercise more. This makes sense to me. And that's not a business owner that is paying for insurance for everybody instead of paying for, you're talking about these big companies that are now their own insurance funds. And they're running these employee health and wellness programs because it affects their bottom line. I'm paying for insurance for everybody. I don't want you to get sick. So, so I want everyone to be well, and we'll pay you to improve your health and wellness. This was just a guy that runs a health food store that wants people that wants his employees to exercise every day. And so I told him about Teams, and I said, you can get the tokens, and then you can create these distribution events. And it's up to him if he wants to tell someone great job in front of everyone, or he wants to speak with them individually to see if they have any assistance. But this is someone that cares about his employees, and a light bulb went off when he heard about the project. And so it's going to happen so many times.
The quote is, if that which gets measured gets fixed. And you're
True.
Creating a measuring tool for something that wasn't really quantifiable.
Mm-hmm.
Other outside of your own individual tracking, like how much I ran, or, how many times I went to the gym, how effective my time in the gym was, and there was an element of the honor system in a lot of these programs where insurance companies would try to incentivize healthy living. And this just breaks it down, because the way my mind saw it as I was reading through your stuff and your materials was like, okay, now this is maybe something where you go to the gym and your gym rewards you with coins the more you go. So in essence, the more you go, the cheaper your gym dues are. And
right.
That should be the way things are. Because I'm an energy guy, and I once had that idea. I was working with a guy in DC, smart guy, and he goes, yeah, what if we built gyms that, all the treadmills made electricity, and then the more you ran on the treadmill, the lower your gym fees were.
That's an awesome idea.
And so we thought it was upside down, but yeah, energy is so cheap in these markets that you would have to really run far to make a dent in your gym dues.
Right.
But this was prior to the knowledge of the blockchain and things like that. So now I can kind of see that if you throw the value at those activities, and this is how it's going to happen, right? When you check into your yoga class, that's connected to your app that your insurance company and your employer may be monitoring, or, you know, you're earning that coin, and then that coin eventually ends up in cost savings for the company.
Yeah.
Because, yeah, I mean, every employer should worry about their employees. We have a teammate that wasn't sleeping, and I'm like ready to kick him off projects because I'm like, don't impress me, man. Like, start getting sleep. I need your top performance, you know. And sometimes, you know, especially guys like come into work and have this badge of courage of how late they, you know, or how much they didn't sleep. You know, yeah, I can think about that now too. Your watch could probably track your sleeping in your ecosphere, you know, your environment.
Yeah.
That your sleep could start getting you either insurance savings or earn you coins. I guess the best way to track sleep is through your wrist movements.
That's how it's being done.
Studies, yeah.
Yeah.
How much your wrist moves, that can tell how, you know, where you are in your sleep cycles and things like that.
Yeah, absolutely.
So you could honestly like create an environment where people create value by getting good sleep. And, you know, as you start looking too, like people talk about this concept that we're going to need a basic income. And, you know, if we can just start monetizing basic human behavior, then people can start affording normal things. So like, and then you got that second, third order effect thing. If like, what if society started sleeping more?
Oh, I mean, everything.
Cortisol levels go down, inflammation levels go down, weight loss goes down. That means that's less fuel on the roads, because, you know, if every American lost a pound, you know, that's 320 million less pounds of, you know, things being carried on our highways and our buses and stuff like that. Yeah. So there are some like remarkable second, third order effects, and you guys are creating a system that allows other people to use their imaginations and other businesses to create these systems of currency around healthy behavior.
Absolutely. I mean, one of our advisors was getting everybody. He was excited, and he's just kind of a passionate guy. So he was going off, and he's like, when you mine a Bitcoin, you use lots of electricity, lots of power, and you get a Bitcoin. He's like, with Clinicoin, you use lots of energy and you get healthy people. And I was like, of course, yes, of course, you get healthy people. That's the outcome. And so, yeah, I mean, it's the most fun thing for me with everything that's happening, and, you know, and it is just, even with us being this close to the sale, the momentum that we have that's building is amazing. And it does take some people like a second to get it. But what's crazy is that this happened to us before, when we had when our company started out in 2008 as a two-way text messaging company. They would say, oh, you know what? I mean, literally people we didn't even know were emailing us, you know, you could use this for text a counselor, text a doctor, text everything. Because they just saw this component of using your phone to text questions and get responses back. And this was, you know, 2008, I think was, or 2007 was pre-iPhone. Yeah. And then Siri came along, you know, and does wonderful Siri things. But we've had that similar reaction from people about all the different ways that it can be utilized. What we learned from that experience was that it's better if we pick short-term paths for focus. And well, we have two things. Either our focus outreaching is in specific areas, or we create a scenario, which is why we're doing this in an open source fashion, where we make it easy for other people to pick it up and run with it. And that's where things get really, really, you know, exciting for everybody, because someone much smarter than me is going to come up with an idea when they see this and just blow us away.
Yeah, no, I had the awful experience of going through the 2014-2015 Ebola crisis in West Africa, and talk about, you know, public messaging and gamification. Had we had this tool where we could start pushing out healthy behavior coins, like washing your hands, I don't know, an array of things that could have happened in that like very, very complex environment where people needed value, they needed money. And, you know, this disease was killing people in the streets. It was the craziest thing I've ever seen. And I can't imagine now, you know, there could be extreme examples where, you know, like Save the Children or all these NGOs are going into these like difficult areas, and they can start incentivizing behavior among people that are very vulnerable. And that's where I can see all this other adaptation for your product in
Yeah.
India, in Africa, in the developing world. And I feel like all blockchain tools might proliferate faster there, where people don't need to be convinced, where there's real problems. And if you offer a solution, they don't need to sit there and contemplate the legitimacy of the algorithms.
Right.
They need to do
That's
it so
true.
they can stay alive.
Yeah,
So,
absolutely.
yeah.
Well, and you know, to your point, about 3 weeks ago, I was speaking with a technical director at the World Health Organization, and she said, "I have 15 minutes," and I was like, "Okay." You know, and I just wanted to run the idea by her, and about 25 minutes later, she's still throwing me, "You could do what you could do," but the thread of all of her comments and all of her ideas were about what you just said. They're about education. She said the number of deaths that are caused, she was talking about indoor pollution, and she said the number of deaths that are caused by people using things in their homes that that the only reason they're using this toxic thing is because their parents and their grandparents did it. And she's like, and there's cheaper and more healthy substances that they could be using. They just don't have the appropriate information. And so all of her ideas were literally about were a lot about outbound and education and getting people access to information who are a lot elements of self-care that aren't in major cities that can't make it to.
Well, I say it more like, more than a human host, bad viruses need chaos to survive, right? Ebola needs chaos more than a human to proliferate. And what you're doing is you're offering algorithms and organization and rules among populations that normally don't have it. And so the faster you can proliferate, smartphones are moving, these digital platforms are getting into the populations. Like, they will spend a great percentage of their annual income to get a communication device and to power that device. So the medium is there. And now if you can gamify and help people create value through these healthy activities, I just feel like, those are the areas that'll benefit most, and you'll get the most, it's egalitarian. If somebody runs 5 miles in California and he runs or does some healthy behavior in Africa, like, they're both are going to be equated in this global market system that you're creating.
Yeah.
And, now, Mohammed and Bob have the same playing field in the economic,
Absolutely.
they're competing in the same thing. Like, you sleep well, I'll sleep well, you run, I run. Or kind of like, together you're creating a connection at a different level. So
absolutely. Well, if I can just take a second, because I know, I want to make sure that we've got blockchain enthusiasts that are watching this, and they're like, okay, where's the blockchain dude? I want to explain. So I started talking about the proof of engagement, because the thing is that, we are now as much of a blockchain and a crypto company as we are healthcare, but we're rooted in healthcare. So I can talk about the project and those uses, all day long. But with the proof of engagement function, what that does, and where this thing I think can get really interesting, is that that after the validator confirms that engagement activity, we're calling it, then that's what gets posted to the blockchain, and then the individual and the validator earn tokens from the rewards pool in that particular context. Where this, when I said that it could get more interesting, is that where this then applies is like, I did show up to the appointment on time because they say scan the code, or I did go and refill my medication, or I had these other aspects. So it's that confirmation of the confirmation of the activity is how we utilize the blockchain and smart contracts. And within our platform itself, and speaking of microtransactions in other parts of the world, our token is an ERC20 token, which is frankly pretty expensive for microtransactions. So we built our own private blockchain inside of our system for microtransactions to be able to happen back and forth before they would leave, our protocol or our network.
So is that more of like a side chain, or is that more of like kind of something similar to the Lightning Network, or what does that look like?
It would be more like a side chain, not like a Lightning Network. It's basically done so that everything can happen quickly and inexpensively. Because you can imagine if in the examples that I gave earlier, that business owner wants to send an employee tokens for, for exercising the most that particular week, or send it to everybody that's doing it, then it just gets way too expensive for them to be able to do it in that particular context. And so, frankly, we didn't know. I didn't know that this was happening until the development team told me, like, we have to create our own private thing internally because it's just going to be the best way to do it.
The scalability hack, like, it's kind of like
that's what it is. Yeah,
going over a couple challenges that blockchains are having on scalability and speed.
Yeah.
Well, and we came across this with, looking at like the renewable energy side and trying to build a coin around that, as we were saying earlier, crypto mining is very energy intensive, which is the opposite of the intention of, building renewable energy coins. So, we're looking at, these second and third generation blockchains that are using things like proof of stake, in your case, proof of engagement, to be able to, transact, but without having to spend and waste all this energy, and have, this concept of, validators or certification. Can you kind of go into like what the validator is? So like in my mind, like, could I go to a yoga class and then afterwards my instructor like hits a button on her phone and rewards me with coins? Is that kind of the idea? Or
that's the idea. Yeah. For someone
for showing up on time.
Yeah. So in the case of the yoga instructor being we call it an IRL validator, just to separate it from the technical side of things for in real life. I mean, it's a silly acronym, but it works. But so that yoga instructor could sign up as a validator in that particular context. And then at the end, they're effectively creating their own loyalty program to have you show up and do it that way. They could just be a validator on the community rewards side of things. But if they wanted to set up their own loyalty program in that context, then they could say, for coming to this class, you will get X number of coins. Our development team, the way that they've explained to me, and the fun part for this for me has been, okay, give the solution, the real world solution, and then watch these guys. I mean, one of our blockchain developers, I swear he's from the future, because he does a good job of explaining it, but when it first comes out, I'm like, okay, tell me, what's going on here. And I know enough to get myself in trouble, let me put it that way. But their take on it is, there's really no difference from that yoga teacher giving you something for showing up to their class and say your doctor giving you tokens for showing up to the appointment on time. The main difference is that when you don't show up to your doctor's appointment, it costs the doctor about $125. You don't show up to the yoga class, there's no money lost for the yoga instructor, but it's maybe 10 or 15, or maybe in San Francisco it's 25 bucks that they're out from you not showing up, but it's not necessarily money lost. So in that context, they both have the option to either proactively distribute to you to incentivize you, or in the case of the yoga instructor, to just be a validator on the network. And then there's elements that are, because I know people ask this all the time, like, well, how do you prevent people from gaming it? Are you gonna there's the joke of like, are we gonna start finding out that there's warehouses in China of people putting their smartphones in paint shakers, and having the exact opposite effect of it. But there's components within it to make sure that people aren't gaming the system, and people ask about that. But for me, I leave it up to the development team to figure out what those things are. The state that I would rather be in is like looking at the way that things can happen. So I'll read about a get paid to work out coin, and they're saying, well, we'll use GPS information to make sure that you're outside. And people are like, why run on a treadmill? And it's cold where I live. I don't want to run outside. And that's their thing to deal with. But I don't want my development team to spend so much time. They have to spend enough time on many things in this world, with elements of just making sure that everything's secure. So they focus on those things. But I would rather see a scenario like a brand, like say the North Face, pick the top 10 hikes in the United States and create a geofencing scenario and say, if you go to this hike and you complete this hike, whether it's at the summit or even at the base of the trail, then we will distribute tokens to your phone. They can do it. That's a marketing and an advertising expense for them. And I think that's way more cool to think about than how do we prevent fraud.
Don't you hate those people?
Because
so you're an idealist, and those guys are like, yeah, sure, for sure, people are going to do crazy stuff, and I'm happy to have those problems. You know, like I hope we live in a world where people are falsifying working out. You know, we'll solve that problem. You know,
the conversation started off early. It was like, well, how do you prove? You know, if someone's logging in and saying they did something, how do we prove it? And they're like, well, at first, you're telling me that they're going to log into an app every day, you know, until the proof of engagement functions get set up and they're connected to these external apps and things like that. They're going to log into our app every day, not exercising to get these tokens. Some people are like, yeah, well, some people might do it, but then someone else was like, but they're logging into a healthy application where there's other people that are involved, like net, they're still going to a place, you know. It's like, I mean, I know the whole joke of like, I go to my gym to use their free Wi-Fi, you know, and I'm not gonna work out. Okay, I get it, but in fact, a friend of mine just told me that he does it, but he's like, but I end up working out, you know. I'm there.
You're getting into, and I'm reading a white paper about a decentralized automated organization, and they talk about monetization of attention. And some things, you know, they talk about the attention economy where, you know, your brain or whatever is in here ends up activating behavior. Behavior is spending habits, you know, so the more Pepsi's in front of your face, the more likely you're to, you know,
right.
About monetizing the attention economy into this impact where you're saying, hey, at the very worst case, we created a thought about value and physical well-being.
Right.
And it created then action where they had to go into an app, you know. So we just took people 3 steps down a healthy lifestyle where everybody else is failing prior to the technology. So
it's so true. I mean, and the interesting thing with that is that there's so many things that you can do, like even on the home screen to engage them or pull them in, where they're reading something or they're feeling, they're getting information or they're getting a element of motivation. But you know, speaking of the World Health Organization, you know, the World Health Organization says that I think it's by 2025, 75% of all global deaths will be caused by what they call non-communicable diseases or chronic diseases. And a large number of those, they say, and a large number of what they call early deaths, you know, people in a certain age group, are from modifiable behavioral risk factors. So you know what they are. It's not moving. It's not eating the right food. It's tobacco use and alcohol. These are all.
I throw not using a toilet in there too, but.
Oh yeah, that's actually
That's on a big global. Yeah.
Absolutely. Those are big ones too. Yeah, and I don't want to take away from the other things that are happening, but the point is that so much of this is behavioral, and so much of our client base are in, even the cancer centers that we work with, we're working with their behavioral sciences divisions, because they're not testing, you know, the cancer center's not testing a new drug. They might be doing clinical trials for new drugs, but they're like, okay, cancer survivors, we got to keep them healthy. We got to keep them moving. They need to get elements of their life back. So how do we use technology to improve these behaviors so that they just don't, you know, that they don't keep going in a direction post everything that's happened to them. And then all of a sudden some other sickness happens to them because they're already in a weak state. And so that behavioral component, I mean, you're dead on with it, is that getting people thinking about it. Or if you look at, he's in the Bay Area, BJ Fogg, he's the Tiny Habits guy. He's like, you know, he's a huge proponent of this. Is like, just brush one tooth, you know, or put on one jogging shoe. You know, it's these simple little things. He's like, don't overwhelm yourself with all the things that you need to do. Or there's that concept of the 3-foot toss. Like, just do something. And I think there's a lot there when you get people focused around this whole idea. I mean, people.
And you can also do, you know, ultimately you can use your app to do a number of healthy things just simply by modifying people's behavior, like you were saying. So like journaling, for example. You know, journaling for me personally, that was once I started journaling and like actually taking notes and like looking back at things I had written, you know, my own data, I couldn't argue with myself. Like I could, finally like kind of go look back in time and see that like, oh yeah, I was really moody last week, or like, yeah, the decisions I made did affect my behavior and my attitude. And I can't, when you try to think back on those things, most of us, how we think, how we are, we're present, and we're kind of in this moment. So it's really hard to remember, what happened 3 weeks ago. But if you have a record of that, if you've got a journal of that, you can look back and go, okay, yeah, I did make a mistake 3 weeks ago, or, hey, maybe that wasn't the greatest decision. And you have that data, and it's your data. So, again, it's you who determined that, what you input those days, or maybe you didn't input. Maybe for 3 or 4 days, you didn't meditate or you didn't work out. And then you can see how, your mood or your health declined because of that. And so even a lack of data is still data in this, in this particular use case. And then when it comes to meditation, I mean, for me, I started meditating pretty much almost daily about 3 years ago now. And I've been using the app Headspace, and it measures and it calculates the amount of time, I've been meditating. And it's kind of incredible to kind of look back on that data and go like, wow, like I have spent entire days meditating over the last 3 years now. Like it's actually probably spanned weeks at this point. And the impact that that's had on my decision-making, my ability to stay calm in situations, my ability to manage my anxiety, all these little things that like I was just not even aware of before, just simply because I gave myself the space and the time to take that time to actually be present and, practice these things. So
it's absolutely.
Go ahead. And you talk about it, Trent, that you only recently, or you can measure the time where you became diagnostic in your life. Now we're creating, or, kids are coming up with Fitbit and these wearables that they're starting to measure steps, right? And there's games to try to like incentivize step taking. But this takes it to another level where you're getting more diagnostic. And just think about that second, third order effect when you start creating human beings that make decisions based off data. That's right. Because you're allowing a lot of data points in people's physical, like, with human behavior, a lot of our behavior, whether it's moving or going to the gym. Now even in my head's now moving on this whole get paid to sleep idea. Yeah, because there's a lot of work. I was watching NPR did this big thing on sleep, and they were like, you know what, a small business owner would have better use of his time and money to get his employees sleeping 4 extra hours a week than getting a master's degree. It's like measurably so much better for productivity. So again, you can assign value to anything with this technology. And if we assign that value to sleep and we can measure it, and of course, some people could cheat it. But once again, it's just the idea of getting people to systematically think about how to get better sleep.
That's absolutely the key. And Trent, speaking of meditation, I mean, when you start doing it in a regular, when you start making a habit of it, and people like, because I will post like I'm 6 months, I don't face brag about all of it, but I'm like pretty stoked because I got 2 kids, and so waking up extra early to get 20 minutes in is no small feat. But people are like, oh, so how has it changed you? And like, well, why? Like that's the other thing is like, what's this transactional element to it? What benefits can you give? And I'm like, well, I just meditate to meditate. I just do it. I do it for its sake. And if I had to explain to you the other things, the benefits I've gotten, I can. It is being more calm. I mean, the whirlwind and the stress that could have been, that this project could have been over the last 6 months, are completely, that and Seneca reading Stoicism, between meditation and Stoicism, it's like, it just, I'm not saying you don't get stressed out about things, but being able to have that base point every day to start my day, or just literally on Monday, because it was our official press release, the company meeting, I said, I don't care who on the call is going to roll your eyes. You can roll your eyes all you want, but I'm asking each of you, I'm giving you a tool. Start every day with 1 minute with your eyes closed in front of your desk and in front of your computer before you start. And and do that. Give that to yourself, and know that no matter what happens, no matter how many questions are coming at us, no matter how many things are happening, nothing is so important in our business that you can't take another minute or 5 minutes and give yourself that little bit of break. And so there's a lot of, I mean, if I had anything on right now, it would be completely blowing up, because Telegram, I mean, it's insane. I love it. But it hasn't been like this. We've just had a regular business, you know, with stuff going. And so all of a sudden, people from all over the world, we're 24/7 business now with people working all over the world. There's a lot of the little wind blowing emojis in Slack. Just letting people know, like, I'm breathing, you know, I'm getting through this. And meditation is an exercise, but it's just as important to your health.
Absolutely agree.
Yeah, and you know, it's a good one on that
slow
one.
sleep, Greg.
Is sleep, meditate? Yeah. Some people I work with neuroscientists. I've done neurofeedback, had my personality map, IQ testing, all that stuff. And, you know, people see it as almost religious mumbo jumbo. And I go, hey man, at the end of the day, I'm happy and I have good relationships.
Right.
And I think that's the biggest measure of anything that people are trying to be a whole person and look into wellness. You know, if you can quantify happiness, like, I don't know, man, things don't razzle me, you know? So like, that's, I guess that's the end state of this. And then, you know, I'm more productive. I have less fear in my decision-making. And, you know, that also helps me with my interpersonal relationships. So I like what you've built, because that helps people think more and quantify and be diagnostic on their health and their well-being. And I think there's going to be a lot of third, fourth order effects of the work you're doing.
I hope so. Yeah. I mean, you know, we speak so much and we've spoken so much in the past several years about patient engagement or engagement. And that speaks to that industry. They understand it, but we don't want to be engaged patients. I mean, no one wakes up and is like, I can't wait to be engaged today as a patient, but you want to be healthy, you want to be happy. And so that was kind of the biggest shift for us. You know, branding and narrative wise, was to focus on, like, okay, let's stop speaking this B2B speak. Let's come back to what it is that's the most, what we feel like is the most powerful to us and to other people. And that's why we have this, that's why we're at this global health and wellness, you know, community component of it, because that's what's going to get the largest number of people excited. But we've got that industry, the industry is going to hold it up and make it scalable and sustainable, in our opinion.
Well, great. Yeah, we appreciate it. And like I said, I want to keep up with you guys. I want to start using and allowing those tools to affect my life. And also, you know, I work in Africa, and there's a lot of people there that could benefit from this type of incentivized lifestyle and quantifiable data. And I'd like to talk to you more on, you know, how we could, you know, maybe help Africans create value by living better. How can people find you? Give us your
you can go to clinicoin.io. If you just search for it on Google, it's CLINI coin, like Clinicoin. And you can find me on Twitter. It's Noel Chandler is my handle there. Or they can search for our company, Mosio, MOSIO, and all these things will pop up. So if anyone has any questions, let me know. And Greg, I'd love to connect with you beyond. And I really appreciate you guys asking me to be on. This has been a fun conversation.
Yeah, no, thank you for being on.